So good afternoon, everyone. My name is Pam Newman. I'm from Parent Health Hub, and we are very, very thrilled to have you all joining us today for our very special webinar about social anxiety in children. Before we get started, there's just a few things I want to mention to you about kind of how the workings of the webinar will move forward. You should be seeing a control panel that popped up on your computer when I started the broadcast. There's an orange arrow kind of at the top left. If you right-click that arrow, you'll have the option to unclick the auto hide control panel. That big panel you're seeing is your control panel. And the reason I'm mentioning that is because if you don't right-click that and unclick the auto hide control, that panel will keep closing up on you, which isn't really a big deal, but if you feel like you may want to ask questions, it's easier to have that open all the time. So again, if you right-click on that orange arrow that kind of points to the right, and you unclick the auto hide control panel, that will stay open the entire time. Maybe easier. So on that note, talking about questions, again, if that box is open, it will make it easier for you to type in any questions for us. You're also going to see a window that says questions, and beneath that, a window that says enter a question for staff. And that is where you're going to type your questions for our presenter. Or if there's anything at all that you want to ask us, if something's going on and you want to ask us a quick question, you're just going to type your question, you're going to hit send, and I will probably be answering your questions. We're going to let Marion present first. It's going, like I said, everyone is muted so that Marion can do her thing. She's going to be showing you a PowerPoint and going through some important issues and things for you to be looking for. About children with social anxiety. And then at the end, we're going to take your questions, and I will actually orally tell Marion there's a question there's a question about this or that. But you don't have to wait till the end to type your questions in the box. You can actually type them anytime during the webinar, and I will save, they'll all be saved up. But at the end, I will actually present them to Marion. Another thing I just wanted to mention is that we are going to be, intermittently through the webinar, we're going to be showing you poll questions, P-O-L-L, poll questions that Marion actually came up with that will help her better understand her audience. Now, they're kind of geared more towards parents, but I'm sure you, as a therapist or a school staff member, you can probably, still give us answers, and if you can, we would, greatly appreciate it. Just to remind everyone, no one's name will ever be mentioned. The presenter and the other attendees cannot see the attendee list, so it's, totally anonymous. So please feel comfortable about that. At the end of the webinar, Marion is going, again, we'll be doing a PowerPoint presentation and speaking, but at the end of it, you will see contact information for her group. And she's going to, I believe she's going to leave it on that last slide while she's answering questions. So if you would like to contact her directly, you'll have all her information, phone number, address, and so forth. And also, always feel free to contact us here at Parent Health Hub at info@parenthealthhub.com. So just to give a couple people a little more time, the little stragglers that we have coming in, I wanted to see if we could do a couple of experiments here, just get you used to the interface, to a couple of questions that would help us. So I'm going to ask you a question, and if you would type in where it says enter a question for the staff, we would appreciate it. Like one of the questions I had was, where are you listening from? What town? Just curious to see where you guys are listening from. So type in where you see enter a question for staff. Type it in there. Okay, so we have someone from Comac. We have from Port Jefferson, we have Massapequa, Setauket, another Smithtown. Okay, great. And another question I have for you guys, if you could let us know, again, just for our information, are you a parent, are you a therapist, or are you with school staff? Are you at a school? Okay, so we have a parent, we have a couple of parents, 3 parents, we have a therapist, we have another parent. Okay, great. So this is interesting. Okay, another parent. Great, great, great. I want the parents to be able to get this interesting information. Okay, another therapist. Okay, so guys, it's about 5 after, so I want Marion to be able to get started. So I am going to tell you a little tiny bit about our presenter today, Marion Molden. She's been working in the field of mental health for children, adolescents, and adults for over 34 years as both a clinical social worker and a special education teacher. Marion is the Director of Childhood Anxiety Solutions with 2 locations, one in Melville and the other is in Miller Place. Also, in her few minutes of spare time, which, believe me, very few, Marion has also written a book, and it's called Charlie's Choices. It's her first interactive children's book, which is about selective mutism. So to tell you, I am honored to introduce everyone to Marion Molden. So Marion, if you could please share your screen. Everyone should be able to be seeing her PowerPoint shortly.
Is it up?
And you're up, Marion.
Terrific, terrific. First of all, I'd like to thank all of you for giving up some time this afternoon to hear me speak about the very serious subject of social anxiety. And I would also like to thank Pam Newman and Rob Kaufman for putting this together for all of us. So today I'm going to cover what is social anxiety, what does it look like, and how do we reverse it? Just what is social anxiety? Social anxiety is the extreme fear of being scrutinized and judged by others in social or performance situations or both. This disorder, I want to make a distinction, is not simply shyness. One does not have to be shy to have social anxiety. Let me explain a little bit to differentiate social anxiety from shyness. Shy youngsters and adults are quiet, and they may not be the person who volunteers, but they will participate when they have to do something. Over time, even though they are quiet, shy people will increase their ability to socialize and do group activities. They may not prefer to do them, but they'll do them anyway. They just need a little more time to warm up than the average person, but then they'll eventually participate. Over time, because a shy person will put themselves out there, they begin to have numerous experiences whereby they can practice answering questions in class or speaking in a small group or developing confidence to make and keep friends. And they learn to understand and through feedback that people really value them and that they do have the ability to do these things. On the other hand, people with social anxiety don't take the same course through life. They often don't develop new friends over time, and they avoid social interactions. They avoid group work. They may avoid doing projects at work or school. And if they manage to do something, they may copy other people around them. Socially anxious people worry a lot about what's going to happen in a certain situation, and they take great measures to avoid that. Another way that this differentiates from shyness is, instead of gaining confidence, socially anxious people tend to get worse because they don't allow themselves the opportunity to practice these types of skills. Social anxiety really severely limits the quality of a person's life. The DSM-5, which is the tool many of the therapists use, or they should be using for diagnosis, defines social anxiety as a marked fear or anxiety about one or multiple social situations in which a person is exposed to possible scrutiny by others. The person fears he will act in a way or show anxiety symptoms that will be negatively evaluated. The social situations almost always provoke anxiety, and the social situations are avoided or endured with intense anxiety. In reality, the anxiety is out of proportion to the actual threat posed by these social situations. And typically, in order to get such a diagnosis, the anxiety or the avoidance should last for 6 months or more. And last but not least at all, the anxiety and or the avoidance causes clinically significant distress, such as panic attacks, depression, or impairment in social, occupational, or other important areas of functioning. Pam, could you put up the first poll question? Okay. All righty. 86% of you have voted so far. I'll give you a second or two to plug in your responses. Okay, I see that the majority, the largest portion of youngsters are 7 to 12 years old, and there are some who are 2 to 6 years old. That's about a quarter. And let's see, the 13 to 18-year-olds, they're about a third. Excellent. The typical age of onset is said to be 13 years old, but as our poll shows, and what we find in the field of social anxiety, is that children as young as 2 or 3 years old can have social anxiety. A tip-off that I typically see is when someone comes into the office, when a youngster comes into the office, and I ask a question, they may indeed just shrug their shoulders instead of giving any pertinent information because they're afraid of being judged. This disorder does tend to hide itself because there's a large avoidance component, so we haven't had much access to children until they go into school. 36% of adults report experiencing symptoms for 10 years or more before they're seeking help. And 1 in 20 people suffer from social anxiety. There are 2 types of social anxiety, performance and interactional. Performance anxiety is when a person has to perform something in front of others, but typically there is no direct talking or interaction with other people. This could include formal public speaking, speaking to small groups, writing in front of other people, reading out loud, eating in front of others, entering a class when everybody is already seated, playing an instrument or sports, or even using the public restroom. Interactional social anxiety are those situations where a person has to talk, listen, and react appropriately to what others are saying or doing. That involves some examples of that would be going to a party, playing a game, socializing with peers and classmates, making small talk, dating, asking the teacher for help or clarification, speaking to an authority figure, going on a college interview, going on a job interview, asking for directions, and alerting someone if they are sick, hurt, or in danger. Pam, could you put up the second poll question, please? Okay, I see that almost 80, oh, okay, over 80% of you have voted. I'll give you a second or two more to plug that in. Okay, let's see the results. So at least 2 times a week at 92%, that's a lot of time. But even more astounding is that there are 8% of people who visit the nurse 3 to 5 times a week. And that is astounding. That's a lot of time out of the classroom. I want to talk about some of the developmental characteristics of youngsters with social anxiety. So in preschool, the child might cry, tantrum, hit, not speak, not participate at all, remain frozen. They may vomit, definitely have trouble sleeping, clinging to a parent, wants to stay home. In elementary school, children may cry, blush, tremble, shake, have trouble breathing, feel dizzy, complain of stomach aches, visit the nurse multiple times. They may not go out of the house. They may isolate themselves. They also may play on the computer for hours on end. They also have sleep problems, and this is where you really begin to see a more pronounced school refusal starting. Pam, do you mind putting up poll question 3? It's very nice seeing all of you give feedback. I'll give you a second or two more. Okay. This is very interesting. Sometimes was 40%. That was the largest majority of responses. 30% said no, and 30% said yes. Thank you. For middle and high school youngsters, they tend to blush, tremble, shake. They have trouble breathing. They may feel dizzy, complain of stomach aches and headaches. They may begin to isolate or have a history of isolating themselves from friends and peers, school and social events. I often tell school personnel and parents to oops, I did something here. Let me just get back to my other, okay. I often tell school and parents to pull up a child's sick days because sometimes we don't realize how often they're absent or how often they miss a class. In high school, they avoid certain classes and assignments. They don't take lunch or they don't eat in the cafeteria. School refusal is very pronounced at this time, and they may demonstrate an inability to do any projects or tasks. I'm not sure if I said this, but they often spend a lot of time on the computer rather than in real life. So how do we treat this? Treating social anxiety. Some of the first things that parents, teachers, and therapists should ask: does the child or youngster have any of these characteristics? Are they avoiding social situations? Are they avoiding situations where they have to perform or produce something in front of others? I'm going to add something that isn't on the screen. I think if you work in a school, if the child is copying, very often in the old days, we used to think that that person was cheating or whatever. In fact, the person may not have confidence in their work. They may be socially anxious, so they think if they copy, at least they have the chance to get something great from someone else. Does your child spend more time gaming versus direct contact with friends? Does your child express feelings of loneliness and boredom? Do you see that your child is rarely or not invited out? And does your child spend, are there any other family members who have a problematic history of social anxiety and or shyness? I want to clarify something. I am saying social anxiety and shyness, even though I differentiated those in the beginning. But sometimes people think that someone with social anxiety has shyness, so I include both of those if there's anyone in the family. Pam, could you please put up question 5? Okay, I'll give you all a few more minutes. I see almost everybody has plugged in. Okay. All right. 21% has 0 in-person friends. As a clinician, that's a lot. I think that that's very serious. Childhood and adolescence are times when someone begins to practice the skills that they have in a family and that they've learned in their family outside. 1 to 3 friends, 36%. 4 to 5 friends, 36%, and then beyond that, there's a huge drop-off among all of you, and there's only 7%. So the question now is, how do we treat this? First of all, there should be collaboration between home and school. It's very important to me, and I often tell people, track what you see. Parents should track what they see at home, and school personnel and therapists should track behaviors or avoidance behaviors or anxious behaviors for at least a week. Now, I do say that parents, school personnel, and therapists must work together. Parents can work on social skills at home, but they can't be with the youngster at school. And a lot of socializing as well as performance activities do indeed occur during the school day. Together, what is really important is to formulate a systematic plan with small steps that can be implemented at home, school, and in the community. And as part of the plan, it must change anxious thoughts, because of course the large component of social anxiety is a fear of being negatively judged. And to help the person to begin to face things that make them anxious in very small steps. Now, I want to say this once, but I have a feeling I'm going to repeat myself because it's very important. If you make a step too small for a child or a youngster or a person to face their fear, nothing changes because the person is not experiencing a tiny bit of fear and seeing that they can handle it. This maintains the symptom. The person has to begin to tolerate small doses of anxiety, and also to begin to realize that our anxiety as well as other feelings are much like items on a conveyor belt. They come through us and then they drop off. They start They come through us and then they drop off. On the other hand, if you make an expectation, a goal, a step too big, you really risk adding more anxiety because the person can't possibly meet that expectation. And as a result, it may indeed backfire because the person will avoid the next time that this expectation is presented. So it does maintain or worsen the symptom. One of the things that is not on the not on the PowerPoint that I would like to mention, because it's very important, is first, validate your youngster's feelings. I know this assignment makes you nervous, but you can learn to manage it. I'll help you in small doses. I know it's hard for you to go to a birthday party in a group, but we'll find ways to make it a bit easier, but you still have to go. And my real big rule of thumb is don't let the child avoid school assignments or social events. Okay, modify things so that the child only experiences a small bit of anxiety. So if you have a child who visits the nurse at the same time every day or at a certain time every day, the reason I say to track it is then you can anticipate it and ask the child to wait 5 minutes because you'll be covering something important first. If the child asks to go to a birthday party, don't avoid it. One of the things, and I'll talk about this more later, get there early so that the child can acclimate themselves slowly to the setting. It gives them the opportunity to sort of tone things down inside of themselves. Okay. Test anxiety. Test anxiety is the youngster is afraid of failing the test, which leads to him worrying that he will fail the grade. People who are anxious tend to catastrophize. They think the worst first. I often suggest to parents that you don't jump in to say, oh, Johnny, you won't fail. You always pass. You're so smart. The reason I say this is I want the client to do the work and to build that muscle in the brain that isn't anxious, that is more confident. So I often instead suggest to parents that they ask the youngster, when was the last time you failed a test? When was the last time you failed a grade? When was the last time the principal came over the loudspeaker and said, everybody stop, Johnny Smith failed his test? This forces the youngster to challenge his own anxious feelings. He has to do the work. Social events, as I said before, don't avoid them. Arrive early so the child can avoid walking into an established event with all eyes on her. That's why I say arrive early. The kiss of death is when you walk in and you're confronted by a group watching you. Now, as any parent would do, and I am one of those, there is a tendency when someone, a younger child goes to a party, we have a tendency to walk in and expect that the child is going to see this as much fun as we do, and we'll push the child, oh, go join Valerie, oh, look, they have something, go, and we're almost pushing the child, and as we're pushing, they're clinging more, and that's because the socially anxious youngster is walking in with an already high elevated level of anxiety. And what we have to do is we have to wait a bit for it to come down before telling the child to avoid others. Because otherwise, if you start to push the minute you go in, that anxiety is going to get higher and higher, and it could be a catastrophe. I also suggest that before telling the child to join others, that you can say to the child, hey, I think I saw something like Play-Doh over there. Come on, I'll go with you. So you have to modify things initially for this youngster. Vacations with the nurse. I have my own personal story about this. My daughter in elementary school used to come home and say, Mom, the nurse's office is the hub of gossip. I know who beat up who. I know who's retiring. I know who's getting a divorce. And also, the nurse, one time she didn't have much to do. She did my nails. Well, I called the nurse and I said, you have to stop the spa activities with my daughter. You have to firm up a little bit. Most nurses are really terrific and they're loving people. But that is really not what you want from a nurse who is in contact with somebody who is socially anxious. They should be caring, kind, but matter of fact. I think the teacher has to observe, as well as the nurse, and note when the child goes to the doctor, to the nurse, because perhaps a particular subject may be difficult for the child, and we are not aware of that. That child might be having problems. I recently had a young man in high school who would go to the nurse at a certain time during the day, and later, over time, he disclosed that there were 2 people who used to bully him in the class. So it's always good to track and study. Engage the youngster in something else before that time arrives, as I said earlier. Start small and then increase the time that the youngster stays in the classroom. The nurse should be matter of fact, and when she calls the parent should tell the child to go back to class for a while. Again, the parent shouldn't automatically say, okay, I'll pick you up. Let the child sit a little bit, unless, of course, they have a fever and are vomiting. Okay. Avoiding clubs. You have to discover what does your youngster love, and then capitalize on it. I often tell parents that they shouldn't suggest that the child join a particular club because the child will just say no. Many socially anxious people are rule followers, so I tell them to call the teacher and have a favorite teacher reach out to the youngster. Susie, I see that you're good in art. We could use your help in art club. Why don't you come? Initially, I would suggest that the teacher or the club leader not draw too much attention to the youngster in the club. And the parents should remind and expect the child to attend the club. Even if he doesn't participate initially and sits in the back, you're just exposing the child to the feared event so they can learn nothing bad is going to happen, and so they can begin to acclimate to the feeling of anxiety. What if they avoid sports? Oops, I'm getting ahead of myself. I often say have the youngster go to a friend's event first, and even over a number of times, very often kids will say, oh, I want to play soccer, I want to play soccer. And once they get there and see that they have to be on that field and all eyes are going to be on them, they refuse. So I say that to have them first go to a friend's event, have her watch the friend doing the sport, even if it takes all season. Everybody has a different timeline depending if it is mild social anxiety or severe social anxiety. Initially, the goal is not to push the child to participate. Instead, you want to lower the child's anxiety threshold and get them used to tolerating some bits of anxiety. Once you notice a shift or a lowering of the anxiety threshold, linger after the game. Invite the friend to invite your child onto the court to kick a ball around. Do this a number of times and then move on to the next step, which may be having the child practice with her friend at a different field, or even getting private lessons. And I think you should do this a number of times. One time is not a charm when it comes to anxiety. I often say to people that working with anxiety is a lot like Goldilocks and the Three Bears. You don't want your expectations to be too big so that the anxiety increases tremendously. And you don't want your expectations to be too small so that the child never has the opportunity to experience his anxiety and get used to it. You want it just right. So, Pam, if there are any questions?
Yes, Marion, hi. First of all, thank you. That was really, really very interesting, very informative.
Thank you.
It was terrific. Yes, I do have some questions for you.
Okay.
And by the way, to the audience, if while I'm speaking and we're answering, you want to send some more, please feel free to do so. So we have a question that says, what if the child did fail a few times? How can you still encourage them?
Okay, that's an excellent question. One of the things that you want to do is look at first, why might the child have failed? Was the assignment over their head, or did they just not study? Are they having some sort of learning problem? Or did they fail because it was anxiety-based? So once you can tease out which thing it is, you can know how to tackle it. Let's say it was, and I'm speaking in generalities because I don't know this particular child, but what if the child could take the test in the social worker's office at first with unlimited time and no one else around? And I would say, in terms of treatment, I would start with things that you know the child will pass and work it from there. Does that make sense?
Yeah, that does. That's actually great. I think that's a great advice. I have another question, and that person said thank you very much. It was helpful.
Okay.
And I have another question here that says, how does garden variety anxiety differ from social anxiety, and do they overlap?
They can overlap. The difference between social anxiety and garden variety anxiety, sometimes called generalized anxiety, is social anxiety is strictly about performance and interaction, okay? Whereas generalized anxiety, you can worry about the weather, you might worry that somebody will die, you might worry that the house is going to burn on fire, you'll get lost, and it may have some components of social anxiety. However, to make a differential diagnosis for the social anxiety, that avoidance and anxiety must be around performance and interaction. Thank you.
Thank you. I have another question from the audience. What do you do if your child has a panic attack in the middle of a party and wants you to take him or her home?
That is really excellent. First of all, one of the things that I said was to track, and if that has happened in the past, you must be on guard for that. Because if the child has a panic attack at a party, like everyone else, once you have a panic attack, you're not afraid of the party, you're afraid of having another panic attack. So the person will avoid any situation that reminded them of that first panic attack. So what I would suggest is, if you know your child is prone to panic attacks, to make it short and sweet to begin with, and end on a good note. I even tell parents sometimes that they can lie and say to the party giving parent, listen, I'm sorry we can't stay long. We just wanted to say hi and drop off a present, and we have a doctor's appointment afterwards, or we have to meet Aunt Fran afterwards, and then leave before the panic attack occurs, because that anxious brain is going to remember that panic attack.
Right. Makes a lot of sense. Actually, another question kind of related to parties, events, so forth. Someone said, how much do you, quote, force a child that does not want to go to a party or event?
Well, let's go back to the examples that I gave. Let's say it's a party or an event and they don't want to go. One of the things, you have a number of options. When someone's socially anxious, they only have one option: avoid. However, you want to give other options. And this is something as a parent that you might have to think about that would be best for your child and at which time. One thing I suggest, and I said it before, get there early. You can also cut it short and say, you know what, Johnny, this is I know you don't like when the family gathers and whatever, but we're staying only for an hour and a half. And also build into that time that you guys can go for a walk together if need be. Some people can't function very well in crowds, and they need those frequent breaks. So you can let that person know. You can also, you might have to get the person to go and cooperate with the first steps of any sort of exposure, like going to different parties or events. You might have to promise them a little bit that, listen, I know this is hard for you, and I understand that, but I'm going to put things in place that'll make it easier. And how about once we leave, you and I can go get some ice cream, or you and I can go shoot a few hoops when we get home.
Okay, that makes a lot of sense, Marion. I do have another question here that I will read to you. How do you address your child when he wants to hang out with another kid, but they do not seem to reciprocate? But my son will push himself on that kid more to almost try to convince the kid that he will have a great time. He then begins to show off and act even more weird, destroying any opportunity to redeem himself in his peers' eyes.
Okay, that's not uncommon. The acting weird, unless the acting weird may be the result of anxiety. A lot of kids will act silly, odd, awkward. One of the problems that socially anxious youngsters have is that they may latch on to another child and really don't know how to navigate that particular relationship. One of the things that you might do is contact the school and find out who is a better fit. And I don't know the age of your youngster, but perhaps you could begin something with a little bit more structured. Let's go throw some basketball hoops, or let's go to the batting range for an hour, or let's go to a movie, and let that youngster begin to know what to expect. But also, I would be working on adding other people to his social life. And also, if I might add, groups, social anxiety groups are excellent for when youngsters act anxious or odd or weird or immature. It really is immature because they haven't had the exposure. And I find with social anxiety groups where they can practice, where on the spot someone can say, well, why don't you ask her this in this way? And why don't you comment on what she said? They're really learning those skills. Thank you for the question.
Thank you, Marion. I think that looks, if anyone else has any more questions while I'm wrapping up, feel free to type in quick. As you can see on your screen, if you need to get in touch with Marion and her staff, I think she's got, what, Marion, you're up to another 3 therapists you also have working.
We have 3. Yes, yes.
So
3 wonderful therapists.
Okay, so you guys, if you do, anyone in the audience wants to contact Marion, and you can see her phone number. Again, you can also contact Parent Health Hub with any general questions about things, info@parenthealthhub.com. And if I could ask if you guys could, actually to info@parenthealthhub.com, if you could send us feedback about this webinar and, did it help you? Was it useful? Was it worth your time? It would really, really be helpful to us. We're still trying to build the company, and we're trying to get out there, and we want to know that, it's being appreciated and it's being helpful to people in the end. So I'm going to say thank you to everyone, the audience, all you guys for showing up. I'm getting, oh yes, actually I'm getting some questions. Would you make this PowerPoint available for download? Yes, we actually, part of what we do on our website, parenthealthhub.com, which we're, email me at info@parenthealthhub.com, and I will send you a link. We are recording this, so you will be able to see it, absolutely. Just give me an email, and I will send you the link. And I am getting some thank yous, Marion. Thank you very much.
Oh, thank all of you.
Very informative. Means so much. Love to have my child's teacher therapist hear some of this information. Great presentation. So we're getting some nice feedback.
Thank you very much. I really appreciate that.
Thank you. And Marion, I can't thank you enough. This was wonderful. And again, thank you again to everyone who participated. And yes, we do. I see someone said, please do one again. We have actually one planned for next month, which will be on ADHD. And then
wonderful.
I'm hoping to get Marion back again because I'd love to do one on selective mutism.
Okay.
That's a big one as well. But I will let everyone go. Thank you again for your time, and enjoy the rest of your day. Thanks all.
Thank you.
Bye-bye.